So my headphones died and it stopped my video. So I'm going to continue it in a second one because that was 19 minutes and I don't want to redo it. So now another thing I learned from this scenario, not really learned, just like got to see it in a scenario and just, really just understand it more, was how we had a question about like what was the priority at this time with his oxygen rate and his respiration rate and what like choice we need to make. And it was that since his oxygen was at 93%, like we were going to discontinue because the rate recommended by provider I think was 88 to 92%. This is just so important with your COPD patients because you can like over oxygenate them and cause that like suppression of breathing and a buildup of CO2. So I did understand that concept before, but it was just helpful, I think, to see it in practice and realize how important it is to be continuously monitoring, watching your rates, like assessing the patient. And it was like throughout the scenario, he would ask for more oxygen. They would constantly be like, no, like, I'm sorry, like you're at rate right now, like we can't give you any more. And that's because of that therapeutic range and the risk with your COPD patients. Another thing, the just like the importance of educating on the signs and symptoms of your medication effects and continuously monitoring the patient. I did like know this going in, but it just put so much emphasis on it because she did like remind him of like the side effects of the medication before, and then she was monitoring him, and this allowed them, to catch what was going on with the ceftriaxone and be able to get him off that med and contact the provider. It's just really important to always be educating on these signs and symptoms before so that your patient knows when they're experiencing reaction and when they need to call you, versus like if you tell them like, oh, this commonly causes headaches, but like you don't need to be worried, then they like understand when it's happening and it's not going to freak them out. And it's just so like they know when to call you, when they know when not to, and they're informed and they're part of the care and they're involved in it. And they have an understanding with what's going on. Okay, so another thing, again, that I understand, but this helped kind of like embed in my brain and put more emphasis on, and just that importance of prioritizing, like assessing for that allergic reaction, especially when you're already being precautious because of his other allergies and the medications he's allergic to. So personally, if I was a nurse, I think I would have stayed in the room with him for a little bit due to his allergy and just assessed him. And I know in like the clinical scenario, I would always like bring up to the provider, like, oh, just so you know, like you did notice he's allergic to ampicillin, right? And that can like kind of interact with the ceftriaxone. That's definitely how I would handle that, I think, in the clinical setting, and just making sure you're monitoring your patient a lot more closely, especially when they have that risk of having a reaction, because it could have been more severe than an itch. So it's definitely important. And I know in the clinical setting, like allergies are such a huge thing to be cautious of. So that's always something that's going to be on my radar, and always using my resources to see which things interact, staying with my patient if there's that possibility, bringing it up to the pharmacist and provider, because sometimes people can miss things, like we're all human. So the nurses are that last line of like protection for that patient, so it's kind of our responsibility to be catching those things. So another thing I realized is just so important are your ABCs. There was like a few questions that revolved around that. Just always remembering your priorities and like that airway, breathing, circulation, like that is life or death for your patient, and it's so important to be focusing on these things, and always knowing when you have problems going on, like that is your priority. Of course, that is something else I knew, but it just shows you in action how important it is, because if you do not prioritize the right thing, like it can be death for your patient. It could be life or death situation. So it just helps me remember how important this is when I'm in the clinical setting, to always have that like on the top of my head and always be remembering that for the safety of my patients. And I think lastly, like a big learning experience I had from this is that chest tube. like the pleural effusion, the thoracentesis. I didn't have a lot of knowledge on like a lot of these concepts. I got to learn from the questions, from the whole scenario. I got to see the consequences of making the wrong decisions with these things and not paying enough attention, not focusing enough, not using my resources. Afterwards, I actually was able to look at the modules that you requested I look into, Dr. McLean from Dr. Rosales, and kind of refresh my knowledge on chest tubes and everything. I watched some videos on YouTube, and I'm glad I have these simulations that I'm able to learn from, and they're able to remind me like what I need more education in, because I would never want to be in a clinical situation and like not have knowledge on something. So it was a huge learning opportunity for me, because I was able to see it in the scenario and then look into it further afterwards. And it's definitely, I think, going to benefit my patient care in the future, because if I have a patient with a chest tube or even in clinicals, I'm going to have such a better understanding and knowledge background on like how to take care of these patients and like what is my priority. So yeah, I think that is all, and answered all the questions.